said, if you think healthcare is expensive now, wait until you see what it costs when it's free. Obamacare is doing well, though. But unfortunately, the rep healthcare bill has failed because 6 senators who voted for the repeal in 2015, that would be Lamar Alexander, Shelley Moore Capito, Dean Heller of Nevada, John McCain, may I have booze, please? Lisa Murkowski of Alaska, and Rob Portman of Ohio, when they actually had a chance to do it, reneged on their repeated promises to their voters to repeal Obamacare. So, the Democrats are certainly celebrating now that the Republicans have given up on Obamacare, and they now have Obamacare in place all alone for themselves. We'll see if they like that, if it remains in place. So, to help us sort all of this out, he's back again. We had him speak on the same subject back in April. Sean Flynn is a professor of economics at Scripps College, where they charge, is it $67,000 a year for tuition?
It costs a lot to become a communist.
But only 12% goes to the comrades in the classroom. The rest of it goes to the overseer comrades in the administration building and other such things. Sean wrote the book Economics for Dummies, which applies both to Republican and Democrat members of Congress and their economic policies. So we're going to hear from Sean about what's happening with Obamacare, what's happening, what was Rep. Carroll about, and was that a good idea, and what we should do next on the subject of health care. And before he comes up, let's say this. Sean's running for Congress in the 31st District. It appears he's going to be the only Republican running for that seat.
Okay.
Sean maybe got himself on the wrong foot back in 2016 running against Paul Chabot. And so some people had some bad feelings about that. I would encourage you, one, because he's the only candidate. Two, give him a second chance. Listen to him anew, see if he lines up well enough with our conservative values to warrant your vote this time. For me and Carol, we've gotten to know him, we think he does, but you need to make that judgment for yourself. And with that, Sean Flynn.
Thank you very much. It's unfortunately the case that most of my other professors in my college really are comrades. And so Ben, I want to just say thank you very much. As someone who had to be a conservative in academia, and actually I started college at Oberlin, which may be the most left-wing school in the country. I dropped out after 6 months because it was just so completely insane. There was no college Republicans there. There were no conservative groups. I was completely isolated, so thank you so much, because I know there are kids out there who literally would be driven away from a college education because all they see are people who don't share their values. So maybe another hand for Ben and everything he's doing. So I'm going to talk a little bit about healthcare. I was lucky enough to address this body back in March, and I emphasized 2 things that neither party is doing. And of course, the Democrats wouldn't do it because they all want single-parent socialism. But I'm a little bit embarrassed to say there are a couple things that we as Republicans should be doing, the leadership, the Senate, Congress, and they're absolutely not doing it all. So the first thing is what an economist would call price transparency. Any normal human being calls this a price tag, right? There should be price tags on healthcare. You should be able to know in advance what something costs. You should be able to know what different doctors are going to charge, and you should be able to comparison shop. It is currently impossible to get those numbers. My mom was a doctor, she worked for Kaiser, she had no idea what anything in the entire system cost. If you have insurance, if you're lucky enough to have good insurance, well, you go in for something, and then 3 months later, not beforehand, 3 months later, you get this mysterious bill with all these crazy numbers, and then they figure out what your deductibles and copays are, and they just say, pay this, with no real explanation, right? And no chance to shop around, get a better deal, and whatnot. We know competition works. I know many of you run small businesses. You know this instinctively, right? You got to serve your customers. You got to provide high quality at low prices. That's completely impossible when people have no information at all, which is our current system. So the first thing that I would tell everyone on Capitol Hill they need to do, it's not on Capitol Hill. I thought it was the senators. The first thing I tell them to do would be just mandate price tags. Just tell providers that they have to tell you in advance what something's going to cost. And then that's the real price, not some mysterious negotiated price with some strange bill later. If you end up being a complicated case, maybe they lose money, right? But they told you it was $10,000 for that surgery and you're paying $10,000 even if it gets complicated, right? That would be fair, right? We have lemon laws, right? You know, if you get a bad car in America, you get to return it, right? You don't have to get stuck with it. And so that's what you get with, you know, competition and whatnot. And these guys, they're having none of it. And, you know, I've been advocating for some of these ideas like price transparency for about 6 years. One of the reasons I'm running for Congress is I really couldn't get anyone to listen. I've handed copies of my book personally to Tom Price, to Rand Paul. Just, you know, politicians are so busy they literally would hand these copies to some 24-year-old aide, and I'm sure they never got read, right? So that's one thing, is the price tags and the price transparency. We're not doing that. And the other, and you know, I'm not going to go into details, those of you who are here in March, there's this magic combination of catastrophic health insurance and well-funded health savings accounts that gives people a reason to save and not to waste money. And you know, that by itself, this magic combination, this insurance, and I explained how it actually completely protects your families because you make sure there's enough money to pay the annual deductibles and the co-pays and stuff like that, so people are protected financially. But they also know any money they don't spend rolls over to the next year. Give them an incentive to shop around, to not waste money, to look around. That combination of catastrophic insurance and well-funded health savings accounts, that cuts healthcare costs 35%. This has been proven to work in America all over the country by Whole Foods Markets. It's been proven to work with Medicaid recipients in Indiana. You can point to numerous examples. That cuts costs 35%. If you also add in the price tags, you get another about 40% fall. There's a 75% total cost savings, right? And you know, this would, man, I mean, you know, take a surgery that costs $100,000 now. There are a lot of surgeries. Imagine that came down to $25,000, okay? And I'm not saying you're going to pay it all. You've got insurance. But the system's going to do that. General Motors, right, is, you know, its healthcare benefits are so expensive. They come out to $2,500 per vehicle. So, any of you own GM products? Yeah, I used to have a Camaro. Yeah, anybody? Okay. Imagine if you could cut those healthcare costs in half. Right? It's $2,500 now, cut it in half. That would reduce the cost of a vehicle $1,250. If you did that not just for General Motors, but every manufacturing plant in America, we would suddenly have the highest quality, lowest cost manufacturing in the entire world, and you'd get all those middle class manufacturing jobs back, right? Healthcare is absolutely killing the economy and strangling us. And so those are the things, before I get into what's actually been done in Washington, that to me are the gold standards. You gotta have price tags, and then you gotta have that magic combination of catastrophic insurance with well-funded health savings accounts. Neither party is pushing for any of these ideas. What's going on right now, you know, there was an epic face plant by the Republicans last week. McCain out of nowhere, I think that blindsided a lot of people, but, you know, the rest of these guys, we were not blindsided. They've been, you know, saying they were going to vote no for a long time, and then they voted no. So it wasn't unexpected. But so what's going on now, Senators Graham and Cassidy, they're trying to get in another version of, you know, repeal and replace. The emphasis in this new version is that all the federal money that's currently going to Obamacare would now be freed up into what's called a block grant. So say California is currently getting $300 billion from the federal government for Obamacare, right? And they're putting it into covered California right now, and other states get various amounts. This bill would say, all right, you're getting $300 billion now, you'll get $300 billion next year, but you can do whatever the heck you want with it. If you want to scrap Obamacare, state of Nebraska, state of Connecticut, state of California, you can. If you want to continue with Obamacare, which unfortunately Jerry Brown would do here, you still get the same amount of money you can, but it'll free up individual states to make their own decisions about what to do with that money, which potentially means they could do some of the things I was just suggesting. So when I say that it doesn't look very hopeful, maybe there's a little hope with Graham Cassidy, right? Because they're going to give the states the autonomy to start experimenting and doing alternative things. Price tags would be, you know, at the top of my list. So that's one thing that's going on. Greg alluded to the best, most epic, actually stand up here. Donald Trump on healthcare. I am the storm. So Trump is threatening to take away from Congress their special privileges on health care, right? Which is great. Congress does this all the time. If you ever bought stocks or bonds or anything like that, there are these things called insider trading laws, where if you have inside information, it's illegal to go out and trade on it. Like, for instance, say you work at a company and you know that, oh my goodness, profits have collapsed. Next week when we announce this publicly, the stock price is going to collapse. You cannot, you as normal people, cannot, me as a normal person, go out and trade on that. You can't sell the stock short, you can't buy it long if it's going to go up. That's illegal. Congress has exempted itself, right? The stock market on average earns 10% a year. The average US senator earns 22% a year. Why? Because they get all this special information coming through their committees. They know who they're going to regulate, which companies they're going to slap a law on. So Congress routinely exempts itself from all these things. So I really hope Donald Trump takes that little thing away from them, which he can, in this case, by executive order. Another executive order with respect to, Donald. Another thing that he's could do and is threatening to do, there are rumors about this. I don't know if he'll do it immediately. I think he's going to play it for leverage to get them to do other things. But you may recall that the Obamacare exchanges started face planning immediately in 2014 and 2015, right? Obamacare was passed in 2010. It started to be implemented in 2014. But when it did, it very quickly became apparent that the Obamacare plans, in our case, covered California, were vastly unaffordable for many people they were designed to help, right? So we've got people who are young people, some of my former students, not economics majors, the other things, but they passed through at least one econ class. I tried to save them. But their gender study degree has left them at Starbucks. They're making maybe $10 an hour. They go out and they shop for an Obamacare bronze plan, and it has a $5,000 annual deductible. Will this person ever have $5,000 to cover the deductible? And then will the insurance ever kick in? No, these people are actually uninsured. They're paying premiums, but they're uninsured. And Obama and the Democrats are out there saying, ooh, we put 50 million more people on health insurance. Well, a lot of them, it's completely phony insurance. And so when these things started to face plan in 2014-15, Obama completely illegally, without any authorization from Congress, just directed one of the federal departments to just start giving extra money to the states to prop those plans up, right? Because otherwise, no one would have wanted to buy them. They would have collapsed immediately. So there were these special subsidies that weren't part of the Obamacare law, that were never approved by Congress. There's no money appropriated every year. And Obama just signed an executive order to do this, completely unconstitutional. So Trump, because any president can undo any other president's executive orders, is now threatening to undo that, right? I think he's not going to do it immediately. I think he's going to do it to get leverage on Congress and the Democrats, which I think is a good thing. But that would be another thing that our president could do right now that I think would improve things. It doesn't get us to, price tags and the other things I love, but there's possibilities for improvement there. So that's most of what's going on in Washington right now. And I was asked, and I thought that was a great suggestion, to take questions. I've got 20 minutes total here. I'd probably use 10 or 15. Should I?
We'll take questions here. Tell us the story about price sensitivity. What happened when Kaiser increased the office copay from $5 to a whopping $10?
Okay, so this happened to my mom. So my mom, great success story. She was an immigrant. She became an officer in the United States Navy, Medical Corps, became an eye surgeon. And so, with that kind of training, being an eye surgeon is just an amazingly fulfilling job because you can literally make blind people see sometimes, right? And so she ended up working for Kaiser. And this story is from about the year 2002, 2003, so maybe 15 years ago. At this point, I grew up in Southern California here, but my mom had taken a job near Portland, Oregon, actually in Vancouver, Washington, just north of Columbia River. And she's working at Kaiser Northwest. And they had a policy back then that it was $5 for an office visit. My mom was working at this gorgeous, it was a brand new clinic, had just been built, beautiful thing, it had this huge open seating area with free coffee and donuts and really nice furniture. And so my mom, being an eye surgeon, probably at least half her patients are, senior citizens, right? Because as you get older, your eyesight's going. Actually, this was the year I was starting to need reading glasses. And so, there are a lot of elderly patients there. And this particular clinic ran a shuttle bus to all the senior homes nearby so people could come for free. And so it turned out that at $5 for an office visit, a lot of seniors thought, this is a great deal. I get to come out and have free coffee. All the other seniors are there. We chat. It's really nice. They have new furniture. It's a swanky building. And they would actually come to socialize, right? They'd also see my mom, but that wasn't really their reason for being there. It was to socialize. Kaiser, for other reasons, completely unconnected to anything that was going on in my mom's office, Kaiser that year raised the office visit from $5 to $10. 2/3 of her seniors disappeared. Because at $5, it was a nice way to spend 4 or 5 hours, but at $10, it just wasn't worth it, and they weren't going to spend the money. Now, the reason this matters so much is, one thing you could say is, wow, prices actually affect behavior, which, of course, liberals don't believe. But the more important thing is that it frees up resources, right? If my mom was seeing healthy elderly patients who were just there to socialize, that's a waste of my mom's time, right? If you look at, training a surgeon, start at kindergarten. To train a brain surgeon, they're not done till they're 35. It literally takes 30 years to train a brain surgeon. Do you want someone like Ben Carson's time wasted by someone who's healthy because you've made the cost of medicine look artificially free? That it's a complete giveaway, which is what, all the communist systems, socialist systems do. They give it for you for free, and then you don't value it, and you waste it, right? And that leads to just disasters throughout their entire society. If the liberals want to look at the most polluted places on earth, and I know we had a huge blow up this week over when was the vote? 2 weeks ago? 2 weeks ago? The most polluted places on earth are all the places where the communists were running, where they didn't put a price on the environment. They didn't say, hey, you got to pay to use this land. Hey, you got to pay to do that. No, we'll just treat the environment like it's open range and just completely polluted. So, thank you, Greg, for bringing that story up, and I think it gets right to the heart of the matter.
Question?
My name's Leonette, and I had my own practice as a provider of women's health and freestanding birthing center. I know everybody talks about, oh, gee, all these people get covered under insurance with Obamacare. Does anybody talk about what happens to the providers that it puts out of business because it doesn't pay enough to stay in business?
Yes, but only a few people on the right, and not nearly loudly enough. For the party that claims it's in favor of small businesses and taking care of individual providers, we don't do it in medicine. We absolutely don't do it. My mom ended up working at Kaiser because the regulations got to be so much, and the malpractice insurance and all these things caused by dumb government policies that she literally couldn't afford. She had to go to Kaiser because even though she'd never been sued, she had a perfect record, her malpractice insurance reached $100,000 a year. And this was like in the late 90s. And so, yes, we put practitioners out all the time. So I don't want that. And actually, a terrible thing about Obamacare that's happening behind the scenes is it's led to a massive consolidation of insurance companies and hospitals, right? Hospitals are taking over other hospitals. There are fewer choices, because the only way they can survive all these massive government regulations is to sort of band together. Because, say Greg had to file 30 hours a month of paperwork to satisfy the government, and you did too. But if you guys joined a group practice, then you could hire Carolyn who could do the 30 hours of paperwork for both of you. So then, just as long as Carolyn was willing to work cheap, right? You could get this done. And so the over-regulation of our healthcare system is forcing consolidation and fewer choices, and also individual practitioners like my mom and yourself are just either, did you survive at all?
No.
Okay, that's horrible. And then my mom's only choice, and she hates, Kaiser's a good place to work. I'm not going to say it's terrible. No, but it's better than not working at all. So that was her choice, right? And then actually she quit later when further regulations about 10 years ago, it was 2009, so 7 or 8 years ago, got to be too much for her. That was the electronic medical records and all the time and waste that went into that. So she literally quit because it was wasting her time so much. And then the world lost a good surgeon. She was only 62. She could have kept doing surgery probably for another 5-6 years. So yeah, I'm glad you brought that up. Thank you.
Shirley?
Hi, my name is Shirley LaRue. On your subject, I just want to give this comment first of all. I think what's going to have to happen, some of this people don't understand. Well, you got free savings accounts, you get this and that. You have to explain where they're coming from. From small employers going to be paying into that. The people, if they don't use it, get it back. It's their money. These things have to be explained far better, in my opinion, so people understand it, because it's hard to understand this. Where's the money coming from and how's it going to work? When you know how it works, it's pretty darn simple. That was my one big comment. As far as, like you talked about, everything's free. When I go to the doctor, I don't pay any copay. And I think it's ridiculous. I can afford $5 or $10, and I suppose everybody is real good too. So it's just eating us alive, because we don't have the people in office that have been in business or know anything about it. So that's the problem. But it has to be explained far more clearly so people can get it on the first go-around.
I agree with that so much, and part of it is, because we need a message that is as clear as the Democrats. The Democrats' only message is, and this was for last week with the Senate bill, if you guys do that, if you get the votes, you're going to put 21 million people out of health insurance, right? They have a very simple message of fear and scare tactics, right? And so we need to be able to develop something that is simple to understand and clearly beneficial. And, at a minimum, it takes me at least 5 minutes to explain it in a way that people understand. And unfortunately, but they're convinced after 5 minutes. But yeah, I agree with you. If I had a way to message this in a 30-second commercial, I would. And actually, I did try this on a mail piece when I ran last time. It said, has a plan to cut healthcare costs 75%. You should have seen how many people on Facebook just thought I was out of my mind, and this had to be completely impossible. So that was not the correct short message. So I at least learned that.
Chuck Schumer issued a statement today that if President Trump cuts off the congressional Obamacare exemption, 1 million senators are going to die.
Well, can Trump do it twice?
Then,
Just a question for you on why the costs have got so high. So you talked a little bit about the competition aspect and how there's no competition in our healthcare system. Are there other factors like the AMA or patent laws that have increased our healthcare? Or is competition the real only reason?
Okay, so there are several sort of factors. And actually, Mayor Rigsby, are you back here? Mayor Rigsby. So Mayor Rigsby is the mayor of Loma Linda. He's also a medical doctor, and he explained something to me, right? He made something clear. It was sort of in the back of my head. And, it's not just healthcare, but any time you have a public-private partnership, right, which is what healthcare is being run as in America, right? We got Medicaid, we got the VA, we've got Medicare, Medi-Cal here, and then the government doing all sorts of subsidies. There are 9,000 federally qualified health clinics in neighborhoods. People don't even know these things existed, but that's all federal money. Whenever you do this, you get a situation where people in the private sector who are in the know and who are connected will use the full force of government coercion to benefit themselves. One of the great things about a truly free market is everyone has to pay the same price, right? If you go into the wheat market in Chicago, it doesn't matter if you're Bill Clinton or me or, some guy sleeping out on the street, everyone pays $4 a bushel for wheat. Right? Everyone, right? There's no ability for the wheat sellers to coerce the wheat buyers, and the wheat buyers the wheat sellers. But if you get a seller, some insurance company, and they get the force of government behind them, almost invariably it attracts bad actors. And my favorite isn't the right way. The worst example I know of this is EpiPens. Okay? So, does anyone here have a severe peanut allergy or bee stings? Does anyone carry an EpiPen? Okay, my mom does too. She's got a bee sting thing. She could die from a bee sting, so she always has an EpiPen. So EpiPens, for certain people, are absolutely necessary to have around.
Hillary Clinton, for example.
Huh?
Hillary Clinton, for example.
Oh, yes. Oh, well, okay. That's the only good thing I've heard so far, that she's going to get overcharged for an EpiPen, and maybe she won't buy one. Any beekeepers in here? Okay. So the EpiPens, if you go back to the year 2000, they were like $5 a piece. They were really cheap, right? Okay, we have nods, right? Okay, we have confirmation. This woman, though, ended up in charge of the company that makes EpiPens. And she had this glorious long-term vision about how to increase demand for EpiPens. Because most of us, we took a show of hands here, most people don't need an EpiPen, so the demand is pretty low. So what she started doing, she hired a lobbying company in 2002 to start convincing school districts that every school district in the country should have a couple of these in every single school with a school nurse, so that if a kid needed an EpiPen injection, they'd have one around. Then they went from lobbying them to actually lobbying state legislatures to make it mandatory for the school districts to have them. And every time they got, the government on their side to raise the demand, they kept raising the price, right? It was $300, then it was $700. It's now mandatory in like 30 states that school districts have to have EpiPens around. And then, this woman's very genius, evil genius, she started putting expiration dates on them. Because then you have to buy another $300 EpiPen every year. And then her coup de grace last year, you now have to buy them in pairs. You can't buy one at a time. And they're like $700 a piece now, right? This is impossible to do in a free market. It's only because she's got the force of government behind her that's ordering all these schools that you have to buy an EpiPen, that she can, basically steal money from society, enrich her shareholders at everyone else's expenses. So, Dusty, thank you for explaining that, because that, in one way, is the best way to think about what's wrong with our entire healthcare system, is we've, alloyed the fist of government, right? Because if it's not kept under control with a small constitutional republic, government always becomes corrupt and, an invasive and sometimes completely destructive force in our lives. If you wed that with private sector greed, and you don't have competition to keep it all under control and directed like the invisible hand, then you have people privateering. One more?
So that'll have to be our last question. Got a good one.
Hey, Sean.
Hey.
Okay, so I'm 22 years old. I'm in college age, and as Brent brought up the point, like, hey, most of these colleges are liberal, and most of them have the idea that universal health care is this wonderful, magnificent thing because they're not paying for it yet. So they're putting in this vote saying, yes, we want universal health care, all this wonderful free stuff. And when they cast that vote, by the time they're 35, have a stable job, it's already too late, and healthcare is already completely down the toilet. So how do we get this to stop now in all of these crazy liberal colleges and get the, no, socialism healthcare is not a good thing. And yes, I am going to call it socialism healthcare.
Okay, do you want to answer the broader question of how we stop the lefties in general in this culture and society, or specifically on healthcare?
So specifically on healthcare,
Okay.
Specifically on healthcare, how do you get their attention saying, no, this is a bad way, this is why we need to do it this way now? So what is your plan to do that?
Okay, so anyone knows how hard this is, it's me. Besides handing copies of my book to Rand Paul and Tom Price, I actually got to present in front of the Secretary of Health and Human Services and her top 100 staffers in the big building in Washington, D.C. on the mall. Out of 100 people, maybe 3 got it. The rest just kind of beyond. They're completely convinced that the system is broken and cannot change. So the insiders, I wouldn't waste my time with them. Anyone who does public policy, any healthcare economist, total waste of time. It's audience like this, because average, ordinary people get it, right? If I'm talking to Tea Party group or Rotary Club, any group of normal Americans, they get it. And so you, I know this, are a genius at internet marketing and social media. I think that's kind of how we're going to have to do this. It's going to have to be grassroots, just like the Tea Party started as completely grassroots and spontaneous. And the message is going to have to be spread peer-to-peer. Because the big health insurance companies, they've done this already with a couple of these plans that work so well. They quietly bought them out. There was like a little insurance company running them and providing all these great benefits. Big major companies bought them out and shut them down, basically. And so there's a lot of money lined up on the other side, and a lot of people getting filthy rich at everyone else's expense. So I wish I could say something more helpful than that, but yeah, young people spreading it and convincing each other, because no one's going to, I'm only 44, but most, except for my classes where they know I can grade them, they're not going to listen to a 44-year-old, right? And so the more young people like you and Ben and Liberty there can spread the word, I think that's how it's going to have to be done. Okay.
Thank you very much, Sean.
Thank you.
more people do it, as shown